Hi everyone, my name is Dr. Kaveh Alizadeh. I'm a board certified plastic surgeon with Cosmoplastic surgery here in New York City. I've been in practice for now over 25 years. I do the entire spectrum of surgical services in plastic surgery, including cosmetic, aesthetic, and reconstructive surgery, as well as med spa related services, which include injectable skincare, lasers, and now regenerative therapies with stem cells and exosomes. Over the past few years, as I've gotten older, I have paid more and more attention when my patients start reporting to me symptoms of hormone-related changes as they're undergoing menopause for our female patients and andropause for my male patients. And those usually pertain to lack of sleep, lack of libido, inability to concentrate. A lot of my patients say when I walk into a room, I don't even know why I'm here. This obviously affects the relationships, and when we do more in-depth questioning, we find that it really permeates throughout. There's physiological symptoms that patients report, especially with women, the classic ones that we know about, which is sweating, hot flashes, but also for men, as you sort of get into more detail, you learn that it's a frequent sleep loss pattern. And a lot of times they're equated to stress-related issues, but it's actually a hormonal mechanism. So it's very important to do a detailed dive into the hormonal status of our patients. And for the past year that I've been doing this, I've learned a lot about how we can help a lot of our patients. For example, patients that are unable to lose weight. A lot of times they sort of feel that they're doing everything right, but it's just not, their body is just not the way it was. And I think a lot of that has to do with examining the thyroid levels, looking at your testosterone levels, the balance between estrogen and progesterone, and in general seeing if we can use some of the peptides that are now available for us to help you optimize your status for longevity. So we've really simplified the consultation process by first, when you come into our office, we have you fill out a simple questionnaire. That gives me an idea with regards to the symptoms that you have experienced that you may not have linked to your hormonal insufficiencies. So once we go through that list and we see that it's actually, there are reasons to investigate this further, we will likely ask you to get a set of labs. These labs are mostly related to thyroid, estrogen, testosterone, estradiol, and some of the other factors that we know get lower as we get past our 40s and 50s and we go into our later stages of our life. Now, why is that important? Because you may have had a set of labs done by your gynecologist or by your general practitioner, and you may have been told that they're normal. However, if you're in the lowest quartile of your group, of your age group, you may still need to be optimized to be able to help improve your symptoms. So even though you're within normal, some patients, for them, normal depends on where you came from. So if your levels are low relative to where you were in your 20s and 30s, it is likely that you're suffering some of the symptoms that we've talked about, such as sleep loss, lack of concentration, lack of libido, and so forth. So what we want to do at that point, if you are a candidate and you have enough symptoms, then we want to start you on a pellet therapy or some of the other modalities that we offer. Why pellet therapy? Well, the reason is because we know based on the available science that if we can keep the levels of your hormones steady, that has the most protective effect with regards to cardiovascular symptoms coming down the pipeline later in your life, as well as osteoporosis, for example. We know that keeping your levels steady is the best means of maintaining your bone mass and preventing bone loss. So the whole idea is to be able to help optimize you for your longevity. One of the great advances in the field of plastic surgery has been anti-aging medicine and its use of stem cells and exosomes, which we're going to be talking about today. So stem cells are really the signaling mechanism that are cell mediators. When you were born in the uterus, remember that you went from a singular cell to multiple cells, and then they became specialized to give you your eyes, your hair, your lips, your heart. Each of these went in a completely different direction, even though they came from the original pluripotent cell. So that's the idea of stem cells, the ability to specialize in something. And exosomes are really the messengers that are delivering the message, whether it's for rejuvenation, for repair, for healing. So combining those things allows us the ability to send a signal to the body to help rejuvenate and repair something that's in need. Now, there's an entire world that's available to us with regards to how we can harvest these cells. So primarily as plastic surgeons, we learn to use your fat because you have the highest concentration of stem cells per cubic gram of tissue. But we also have the ability in our practice to actually harvest your bone marrow, which has very, very high levels. Especially as you get older, you want to be able to tap into higher levels of stem cells. But at the same time, we've been also reaching out to obtaining stem cells and exosomes from placental tissue as well as umbilical cord tissue. Why is that? Well, we know that a newborn has the highest level of activity. And sometimes we know from our research that if you're over the age of 55, which essentially matches up with having gone through menopause, our own levels of stem cells and ability to repair our body really takes a nosedive. So we want to match that up with bringing in stem cells with a source that's able to compensate for that and to be able to get you to heal faster. Of course, I'm very interested in that when I do surgery, right? So if I'm doing a facelift, I'm always using stem cells because I want to minimize the time of healing, swelling, and bruising to help expedite your recovery. If I'm using if I'm doing fat grafting for breast enhancement, for example, I want to mix those stem cells with your fat to make sure that I have the highest level of viability and the best take for your fat to have the best outcomes. So you can see how these two have come together to provide the best outcomes. And that's the conversation I want to have with you when we talk about doing any kind of procedure. At the minimum, it would be, let's say we're doing a laser procedure and we're doing some resurfacing and we want fast healing of the skin. And now we know that by applying the exosomes to your face, we're going to have a much more rapid recovery. On the other end, let's say if you are a male who is starting to notice hair loss, well, we can get exosomes that help deliver the messaging to the hair follicles to stay in their on cycle so that you can have the most active hair possible and to try to save your hair follicles before we're at a point where we have complete hair loss. Right, so it really comes in all facets of what we do in our daily practice. And within the world of hair rejuvenation, now we have a lot of great options that are available for us. So if you think about it, you want to, number one, you want to make sure that you have adequate supplementation to withstand the changes that are happening as you're aging, right? So that we do that with supplementation in our office with Nutrafol. The second thing that you want to make sure is that you have medications that are acting at the receptor level to make sure that the DHT hormone is not causing the hair to fall out, right? So we provide a hair drop that is essentially a prescriptive hair drop with high levels of concentrations that are adequate enough to be able to withstand the active phase of hair shedding that's going on. So once we put you on those, the next step is how do we boost the hair that you have? And that's where the stem cells come in. Now we have a new process called ExoBoost. And ExoBoost essentially takes your plasma at a very high level and concentrates it and gives a sort of these pellets of power that are injected next to the hair follicles to drive the messaging for the hair to stay in its active cycle. That's important because your hair is going through a sort of a hibernation cycle, an active cycle where it comes out, and then a shedding cycle. We want to minimize the shedding cycle, minimize the hibernation, and maximize the active hair cycle. And when you're in your 20s and 30s, that's the primary means that I use to be able to maintain your hair. Now, let's say you come into me and you're in your 40s or 50s and you've already lost the hair. You see that sort of shiny scalp that gives that message that unfortunately the hair follicles are gone. And at that point, it's sort of irreversible. So, doing some of these other steps is not going to bring the hair back. So the next step would be to do a hair transplant. And the good news is that it's no longer the old hair transplant where you have to go out and cut something and there's a scar. Now we're able to use follicular unit extraction to be able to get individual hair follicles or even families of 2 and 3 that look good together and move that as a unit to provide a really nice natural hairline. A lot of great options available, but it's really important for us to customize that to your need and have that conversation when you come to see us in the office. So the most important decision that you make when it comes to medicine is who your doctor and who your provider is going to be. Who's the team that's going to be delivering this care for you? Because remember, you get one body and usually you get one shot at this. I see a lot of patients who've come in, for example, for their hair, and they've gone to not the most reputable practices for hair transplantation. And unfortunately, the hair doesn't work well, but they've lost all the donor sites. So it's very hard to help a person when I don't have enough donor sites to work with, right? So that's one example. Or when you come in to get a facelift, if a lot of scarring takes place, it's much harder to sort of come back from that. So I want to make sure you understand that that decision that you make, you want to go to at least a board certified plastic surgeon. You want to go to a practice like Cosmoplastic surgery where we have seasoned nurse practitioners, physician assistants, nurses, people who've been in the field for 20, 30 years and have done this for a long time on thousands of patients. And that's why I want to make sure that you get all the information, make sure you get different perspectives, make sure you talk to patients who've had these procedures, and we look forward to welcoming you and discussing with you in person.
Hi, my name is Ali. I'm the patient navigator at Cosmoplastic Surgery. I want to thank you all so much for attending our virtual event. Please make sure to check your text messages to book that consultation, and we're happy to schedule you. Now, for our Q&A, make sure you write your questions in the question box, and for our raffle winner, we will contact you via phone call.
All right. Well, welcome everybody. Thank you everyone for joining us. I am joined by Alejandra. Ali, you want to say hi?
Hi everyone. Thank you so much for joining us tonight. We're thrilled to have you here, and this is a wonderful opportunity to get your questions answered by Dr. Alizadeh. To make tonight extra special, we're offering some exclusive perks for our attendees, which will be $500 off Exosomes, 1 month of complimentary vitamin shots with the purchase of hormone replacement therapy, and one lucky attendee will win Revision Skincare bundle for the value of $350. So we're excited to share this time with you. We look forward to welcoming you in our practice. Now I'll turn it to Dr. Alizadeh, who will be answering all of your questions.
Thank you so much, everybody. Thanks for joining me and our practice. I hope you're nice and warm and cozy, at least in New York. It's super cold. Happy to answer the questions. I'm just going to go through some of the questions that I've received so far, but please feel free to post any questions you have live so we can answer them for you. So let's see. First question that I see is, how long does it take to start feeling results? I'm going to assume that's about HRT. So when we start just to go through the process, so the first thing we do is ask you, we present you a series of questions to understand what your symptoms are, because we want to we're treating the symptoms. We're not necessarily treating a number of what your hormone level is. And I say this to a lot of patients who see me, say, I went to my GP, they did a bunch of labs, everything is normal. Okay, well, it could be normal, but if you're having symptoms, that means that your issues are not being addressed. And as I mentioned earlier in that video, a lot of the patients, what happens is many of us may feel good going into our middle age, and we may then start feeling things, and we may go to our doctor, whether it's our gynecologist or general practitioner, and say, listen, I don't really quite feel myself. And they're going to say, well, you're probably going through menopause, or for men, you're going through andropause. Let me check your labs and see where you're at. The labs come back and like, all your labs are normal, so no worries. I'll see you in a few years. I'll see you next year. The problem with that is that you may have normal levels, but they're actually on the low end of normal. And for some people, The difference between being on the high end of normal could be like how you were in your youth, and the low end of normal is not having enough energy, libido, having hot flashes, not sleeping well. There's so many symptoms that are connected to how we feel. And usually it used to be that I just feel older, but now we understand there's a lot more that's going on, right? So whether it's a functional problem, which is, let's say your sugars are high, your weight is up, and now you're at risk of diabetes, or it could be something very simple where you feel super healthy, you're doing well, but when you work out, you feel like you just don't recover as well. So there are things that we can address by understanding those symptoms first through this questionnaire and really doing a deep dive with where your symptoms are, and then looking at your labs to see where our starting point is. We really use that as a starting point. And then based on the treatment, we can sort of guide ourselves as to how are we doing? Are we too low? Are we getting to where we want to be? And then once we know where your symptoms are, we can adjust it based on that. So, so with regards to how long does it take to start the feelings, energy is usually the first thing that comes in, and you feel that usually within 2 to 3 weeks. A lot of our patients say, wow, I just really feel much better once you've been on hormone replacement therapy. And then there are things that adjust over time. And those are the kinds of things that do take months. They can take 3, 4, and up to 6 months. And so, and depending on how we treat you, we're going to sort of guide you and get that feedback and be able to manage you going from there. So Jackie asks, how long do pellets last? And similar, how long do pellets last and how often will I need to replace it? So we like pellet therapy, and mostly there are many options available. So just to review that, you can take pills, you can have a patch, you can have regular injections, or you can do pellets. The reason why we like pellets is, number one, you don't have to worry about, did I take it, did I not take it? You don't have to worry about reactions that you may have with a patch that you're going to put on your skin, and it may not actually be active enough. And then the most important reason for the pellets is because we want to maintain a steady state of your hormones, which somewhat matches the way things used to be in your youth. And what we do, just to make sure that it's safe, we like to start at a lower than expected level, check your labs usually within 2 to 3 months, make sure we're on target. If we're on target, great, and we can just keep going. But sometimes if it's a little low, then we can always add up and maintain that. But to answer your questions, pellets usually are about every 4 months on average in terms of how we manage it. Let's see. Can I stop HRT at any time, and what happens if I do? Yeah, of course you can start hormone replacement therapy at any time. But as you can imagine, you sort of go back to your baseline, right? That's the same question I get with Botox. People say, okay, I'm really worried if you're going to start me on Botox, I'm going to have to be dependent on it for the rest of my life. And my answer is no. Actually, if I stop, you're just going to go back to what your baseline was before you started Botox, right? Sort of think of it as exercise. The best analogy I have is you start working out, you feel really good, your body is responding to you, your mind is responding to you, you know you're in a better place. But if you stop doing that exercise, over time, you're going to regress to where you were before you started your regimen. So very similar to that perspective. All right, Jackie, another question. What are the potential side effects or risks associated with HRT? So like anything else, remember, these are active hormones, right? So anything that's active can potentially, like if you take aspirin, 1 aspirin may make you feel great, but if you take 10 aspirins, it can make you bleed, right? So it's really important to go to the right practitioner, to the right practice that understands the nuances of each of these things, and any little, variation and diversion can make a difference. And that's important to go through that list with your provider to make sure you understand what it takes. And if you have any symptoms, to report that to your provider so they can help adjust your medications. So our next question is, how do I know that I'm the right candidate for HRT and that it's not just a trend? Well, it's certainly not a trend because we do have an incredible amount of science. And I think if anything, there was a controversy about hormone replacement therapy because of a study that was done about 20 years ago that showed that there's a potential risk, especially for women and breast cancer. Now, that has completely been debunked. There is a lot of good science that has appeared since that report. And if anything, we now know that they sort of jumped the gun with regards to that report that came out, and it became popularized on the cover of Time magazine and so forth. That scared a lot of people. As a matter of fact, FDA just reversed their position on this last month. They reiterated as of last month. So the FDA has actually taken a position to say that hormone replacement therapy is safe. But again, just because it's that way doesn't mean that going to any door and knocking on and saying, "Can you help me?" is the right place for you or is the right thing to do, right? So it's no different than any other aspect of medicine. You have to treat this not like a sort of a casual thing. This is something that's really medical, physiological, and functional medicine. So it's really important to have the right providers at the right place that are following up with you and giving you the right advice. Our next question is, am I a good candidate for bioidentical hormone therapy? And are there specific health conditions that could prevent me from receiving it? Yeah, I think we've sort of touched upon this. I think that most people are good candidates. However, let's say you have a history of estrogen positive receptor breast cancer. So as you can imagine, if you have that specific condition, you're not really a candidate for estrogen therapy, right? Because it's the estrogen receptors that are positive for that breast cancer, and putting more estrogen to them is not the right idea. So that's, again, the reason why I ask you to be very vigilant about giving your complete history, making sure your doctors and health practitioners are getting that full story from you. They understand not only your story, but your genetic story, your family history. And then as you go through it, and if you have symptoms, you share that with your providers so they can manage you and guide you appropriately. All right, so next is there a right age to begin hormone replacement therapy, or is it more of a symptom that makes us the right candidate? I would say for the most part, hormone replacement therapy is really related to our middle age, because even though some people can go through menopause much earlier, like in their 30s, most people are seeing it in their mid to late 40s or up to mid 50s. One thing that is really interesting is that when you look at the studies, women, especially with women, some of these studies were done. If you're doing hormone replacement therapy before the age of 60, you're much more likely to be able to play catch up and have resolution of a lot of your symptoms, and also prevention of some of the things that are seen as you get older. The examples of that are cardiovascular issues or bone-related issues, right? So it's really important that you seek the attention of your doctors earlier and not wait as long, because the benefits are going to be able to supersede the wait time. So that has become very clear. And so we're going to touch upon that as well, or maybe let me make that transition to exosome as well. Exosomes is the next topic that I touched upon in our introduction. And what's interesting is that with exosomes, we're also seeing something very similar, which is if we use your own body's ability to repair things tends to sort of flatten out when you're in your 50s, which is why we need that extra boost with exosomes or stem cell related things to help give that extra push to the body to help repair, mend, and rejuvenate itself. All right, so does HRT help with managing symptoms associated with PCOS, such as irregular cycles, weight gain, and facial hair growth? Yeah, it does. Because what is PCOS? PCOS is essentially a hormone imbalance, right? Polycystic ovarian syndrome is essentially a condition where your hormones are off. And that can lead to a number of secondary issues. And not only what you're seeing in this question, which is weight gain, but over time, you can imagine as you have a lot of weight gain, that could potentially lead, for example, to diabetes type 2 and a lot of cardiovascular related issues. So it's really important to nip this in the bud earlier and manage it sooner. And it really depends on the condition and what it takes. We do work with our colleagues, and this, we really see this as a multidisciplinary approach. And especially for some of our younger women, we do want to bring in the additional help of our endocrinologist colleagues to really make sure that we've addressed everything and you're sort of seeing the whole picture. All right, so next is, is there a right age to begin hormone replacement therapy, or is it more of a symptom that makes us the right candidate? I would say for the most part, hormone replacement therapy is really related to our middle age, because even though some people can go through menopause much earlier, like in their 30s, most people are seeing it in their mid to late 40s or up to mid 50s. One thing that is really interesting is that when you look at the studies, if you have that specific condition, you're not really a candidate for estrogen therapy, right? Because it's the estrogen receptors that are positive for that breast cancer, and All right, so our next question is, what are the most common results you see in your patients using exosomes? So exosomes, just to sort of, reset the conversation about exosomes. Exosomes are essentially tiny little vesicles inside our cells, scale. They sit inside our cells, and they're essentially messaging particles. So think of it as if your body is like your texting machine, which is sort of communicating and going back and forth between the cells. The exosome is actually that text message. It's giving the signal, right? It's giving the signal that it's now time to repair. It is now time to heal something. It's now time to bring new blood vessels, for example, or to grow something. So we need those cells because, as I mentioned to you earlier, as we get into our 50s and in our middle age, those signals are sort of reducing. The volume is going down. So the body is not able to repair itself. We're constantly being exposed to external factors, to inflammation, to radiation, right, to sun, wind, as well as inflammation through food, the diet that we have, and then the ongoing wear and tear of the body, right? So these signals need to be there to help repair things, to maintain your body and keep it going. And as they go down, you start seeing the signs of aging, right? So that's where exosomes are important. So let's talk about the three big categories that I see the role of exosomes, at least in our practice. So one is hair loss, right? So your hair is really going through this up and down cycle. And depending on where it is in the cycle, we can help bring your hair from its transitional cycle or from its resting cycle into an active cycle by giving that mechanism of signaling with the exosomes. So how do we get the exosomes? Well, there's different ways we can do that. We can either do it through our proprietary mechanism, which is ExoBoost, where we're taking some of that plasma, concentrating it, and then injecting it into the scalp. We can do it through a mechanism of fat, where we take your own fat because it has the highest concentration per cubic gram of tissue in your body. So we can sort of isolate that and then use that to inject it. And then last but not least is we can actually go through other sources. So we carry a product called pellet, for example, that's a recombinant factors for platelets that are derived from platelets. We have a product called Essence, which is another synthetic version of this. We also carry products that are embryonic, that are coming from umbilical cord or from placenta. They have a lot more. So again, it all depends on what your condition is and how we want to use it and what capacity we want to use it. So that's one category. We talk about hair. The other category is for skincare, to help boost the general maintenance and corrective nature of the skin, for example, for pigmentation, for texturing, and essentially general aging issues that happen with the skin. And then last but not least, I actually use exosomes to help with the survival of my grafts. So if I'm doing a hair transplant, for example, I'm floating the hair grafts in these exosomes to help boost its ability to take. If I'm doing fat grafting to the breast, or if I'm doing fat grafting to the face, I'm actually combining it with the stem cells at the same time. For example, if I do a facelift, pretty much every facelift that I do now, I combine it with a stem cell and exosome. Why? Because I'm also doing fat grafts, and I want my fat grafts to be combined with that to have the best chance of survival. So there are different reasons and there are different mechanisms in the modern era of medicine as to why we want to maximize our results. Elena, how are you? So Elena says, can someone experience adverse reactions when receiving exo stem cells or foreign stem cells? Well, so the quick answer is no. And the reason is because a lot of the exosomes that we're using are actually coming from yourself. So it's hard for you to have a reaction to yourself. And they're minimally manipulated. It's not like it's a drug that we don't know what's in it. And then the other ones that are coming, they're sort of, if we have something that's a product, they're either a recombinant technology where they're not human, they're not coming from another human, or if we're using it in a capacity as a cell line that's coming from an umbilical cord, for example, they've undergone strenuous FDA guidelines to make sure that they're clean and pure, and they've been sort of undergone studies. But that brings up a fantastic question, Elena, which is, don't just believe that someone, because you read on something it's an exosome, it's a good product, it's the right product. And also, if it's a plant-based exosome, its active ability to do anything for you is close to zero because it's crossing multiple species. So the best reaction you can have, if I'm a human being, I want something that has the best reaction for me in terms of its proximity in my DNA content, right? It needs to be close to me. So the next best thing is going to be not a plant, but a mammal, right? An animal species, a mammal, and then a reptile, and then a fish, and then you get, so you're far away when you do plant. Why do companies do plants? Because it's easy. It's easy to extract, it's easy to put it, but it doesn't mean it's effective. No one has adequately shown that a plant extract exosome is actually very active in humans. It's all theoretical. It's easy to sell and it's easy to mail to you because it's not under FDA guidelines. Again, another reason for why you need to go to a proper physician and the proper practice that is abiding by FDA guidelines and also are board certified, so they're doing the right thing for you. Let's see. So the next question is, how do you deliver exosomes for hair restoration? Microneedling? No. So if we're doing ExoBoost, which is taking your own plasma and concentrating it, or if I'm using your own fat and getting the exosomes from that, I like to inject it. And the reason is because I want it to be exactly sitting next to those hair follicles, where in that milieu where the hair follicle is where the signaling is happening. So I want to be right there. Why do I not put it on top of the scalp? Well, because our skin is a barrier, right? So you're not going to be able to have it get in through that barrier. But you're right. If I wanted to use it as a topical, and with some of our exosomes that we have, which is like, the umbilical cord line exosome and so forth, we do recommend a combination of microneedling and putting the material, because now you're opening a door, you're opening a channel to allow the medications to get in. So that is a good reason to do that. And then last but not least is we have our plated product. Some of the lines that we have, and again, it's really important to understand, not all skincare lines can do this, but some of the skincare lines, they have developed a ability to cross the skin barrier through liposomal pathways or other pathways that allows that material to get across that barrier. But if you put something on your skin, it's not going to get in, right? So I want to make sure you guys know that. Just because you buy something on the internet and it says, I have the highest level of collagen on planet Earth, great, but that's not getting in your body. And by the way, same thing if you're eating collagen, just because you're eating a lot of collagen or bone broth, no one has been able to show that taking an extra amount of that is going to go directly and make you more skin, right? So I just want to make sure you're clear in terms of delivery is important, the dosing is important, and the means of processing is important to get to your result. That has been proven. Lisa says, how long is a hair cycle? Well, hair cycle, so think about hair as, my analogy for hair is like a bear. So you have the bear, which is sort of in its hibernation cycle where it just sleeps. You have it in its active cycle where it's just on the move and on the prowl. So for our hair, the active cycle when it's in its full growth phase. And then there is the hibernation cycle where it's sort of, anywhere from 3 to 6 months where it's quiet and dormant. And then you have a transitional phase where it's going from one to the other, right? So the active cycle can be anywhere from 2 to 7 years, depending on what you're going through, which age you're at. Again, hormonal, stress, how it's being treated. There are many, many factors, but that's usually the cycle. And then in terms of the response, I'm guessing what you're getting to is that if I do some of these treatments, how long should I expect before I see results? And my answer to that is that you may start seeing something, but usually you sort of get to that steady level of the most response by 6 months. So Pamela, I think similar. She says, how often do you have to get HRT? Depends on what you're doing. So if we're talking about pellets, I think as I mentioned earlier, you're looking at about 4 to 6 months, depending on what you're doing and how we're going to do it. And then we talked about exosomes. So exosomes, let's just make sure we're clear on that. Stem cells, exosomes, again, that's like saying a car, right? But then you have a Lamborghini and you have a Chevy, very different performance, right? So just because someone says I'm going to do exosomes doesn't mean you're going to get the exact same response in that office versus coming to our office, right? So for example, everyone has heard of PRP, right? So PRP is a very weak stem cell activity versus if I take your fat and I use that exosome, that's a high level of exosome activity. Or if I take your bone marrow, or if I take some of these placental based. So the more active, the more, colony units, CFUs, the more colony units you have, the more active, you could have billions of these exosomes within it. But are they active and are they delivering the right mechanism? The more of that you have, and you have to go to the appropriate place to make sure you're getting that, the quicker your response is going to be, right? It's no different if I'm fertilizing a field. I can sort of depend on the weather and everything to go well, and I hope that goes well. But if I add really good seeds that are fertile, that's even better. And if I add much better dirt where the seeds are, even better. And if I add a fertilizer to that, that's my best, right? So the best of the best. So think of that fertilizer equivalent to your exosomes, right? It's bringing in an additional help so that the seeds can keep growing and doing what they're doing. All right. Maria wants to know if a patient has vascular disease, can they receive hormones? You have to tell me what that vascular disease is. I don't know. Are we talking about cardiovascular disease? Or are we talking about an inflammatory vascular and autoimmune disease? There's so many different, which is, again, please, my biggest concern is when patients go on social media and they see this is good for that. And I'm like, okay, that's going to be good for me. It's a lot more nuanced than that, right? So you have to really, really make sure that you're examined by the right physician who is asking the right questions, diagnosing you properly, prescribing the right medications, and then staying with you to make sure you're getting to your outcome. Okay, so all of those things really make a difference. But I'll be happy to have a conversation with you to really understand more what your diagnosis is to be able to help you. What is the exact name and manufacturer of the exosome product you use to treat hair? Well, I think I mentioned earlier, we don't just do one thing. I think currently we have about 6 different products that we use. So it starts with your own PRF, which is a fibrin, platelet-rich fibrin, and then ExoBoost, which is we're taking your blood and concentrating it down. We talked about fat, also coming from you, right? There are many different products. So again, happy to have that conversation with you and see whether you're a candidate for an autologous route. And as I mentioned, usually up to the age of 60, you're a good candidate for autologous, means coming from yourself. But once you get older, you really need to have that extra boost. So we have to bring in additional high-powered concentrated material to help you get to your levels that you need to get. Maureen wants to know, can we be seen in Long Island office for the HRT? Yeah. I mean, so we have 2 offices, both on Park Avenue in the city where I'm here now. Ali's sitting in our Jericho location. Happy to see them both. And we have Nick, who is our nurse practitioner. He's lovely. He's in both offices. Annika, our nurse, is in our Jericho office. And Sophia, our physician assistant, is also at both offices. So there's 4 providers that can see you for any of the questions that you have. Bahar, can we start HRT at any time after menopause? Yeah, and I think that the earlier you do, well, first, remember, you got to make sure you're a candidate for it. So that starts by asking the right questions, making sure we do the labs and making sure that you're a candidate. But once you are, then you should be starting sooner than later, because the later you start, the less of the benefits you're going to see, as I mentioned earlier. I've been told it's detrimental if it's more than 10 years after onset of menopause because of blood clotting factors. No, I think some of these, again, there's a lot of sort of myths surrounding this. So it's important for you, for example, if you are on hormone replacement therapy, to tell your doctor if you're undergoing a long surgery. So that is true. but by itself, you're not at risk. There is a genetic mechanism, there's a genetic causes that puts you at a higher risk, but not, I mean, these are rare conditions that makes you more likely to clot. And again, once we sort of know that about your genetic history, which is what I was saying, make sure you explore that with your doctor so that they understand what the history is. But by itself, it's when you look at net, you look at the benefits that you get from HRT, from some of the potential risks. Medicine, we're always sort of looking at pros and cons, right? What are the benefits? What are the risks? Net is definitely positive. When you look at cardiovascular benefit, neuroprotective benefit with regards to degenerative diseases, Alzheimer's, a lot of the cognitive issues that you see over time. Bone, we talked about bone metabolism, right? So there's so many, muscle. Now we know, for example, the elderly, what is the number one cause of elderly having problems? Frailty. Frailty has to do with loss of muscle mass. Loss of muscle mass then leads to inability to balance yourself, which means you're likely to fall, which means you're likely to get a hip fracture, which means then you're likely to have blood loss, which means that then you're likely to have a heart attack, or everything is connected to everything else, or being hospitalized for a long time, right? That could put you at a high risk of infection. These are all connected. And when you trace these back, now we have this perspective where we believe, I'm sure you've seen some of the work of people like Peter Attia or others that are into longevity medicine who talk about nipping this in the bud much, much earlier and coming at it much earlier to make sure that you have enough reserves and that you're not getting there when you're in your 80s and 90s, right? That's why we want to jump on this as soon as we can. Let's see, what hormones are used in the pellet? Well, again, depends. What hormones are used depends on what hormones you need, right? So it's important for us to assess that. Do you need to be on thyroid hormones? Do you need to be on estrogen, testosterone, right? So a lot of these are really connected to some of our patients. Just putting you on peptides like GLP-1s, right? Like the classic Ozempic, tirzepatide, that has a huge change in how you feel and your energy level. Just bring your weight down by about 10 to 20% makes a huge difference, right? So it may not necessarily be hormone related, it may be more peptide related. Let's see, is this product FDA registered under the 361 pathway? I don't know which product we're talking about, but to answer your question, I think Sunny wants to know. So this sort of brings up 351 worth of 361 pathway. These are sort of the pathways through the FDA, where the FDA has made a decision. I think it's a good question that everyone should know about. You want to make sure you do talk to your doctors that what they're doing is approved by FDA. It's done the right way, which again, why you need to go to a reputable practice and reputable providers. So the pathways are essentially differentiated between a pathway where it's minimally manipulated, for example, as we talked about, using your own fat or blood, just processing it, concentrating and putting it back, or you're going to use an enzyme or a drug to change it. And that's where FDA has put a sort of a block on the use of that pathway. But unfortunately, they're all sort of being under the whole sort of the heading of stem cells, right? That's why it's really important not to treat them all the same. It's really important to understand where they come from, how they're processed, and how they're being administered to you. Next question is, do you provide bioidentical hormones? Yes, they are bioidentical hormones. So we do use bioidentical hormones because they have the closest relationship in their chemistry to your own hormones, which means your body is more likely to accept it. Any downtime after getting the pellet? No. So the great thing about the pellet therapy is the actual procedure takes about 2 minutes. It's a tiny little incision. So, essentially what we do is we give you a little numbing. We make a tiny little incision, maybe about a quarter of an inch. And there's a sort of a device that we introduce. It's a tiny little pellet. So we just introduce this device, and then we literally just put a little Band-Aid on there, surgical tape there, and it just heals up. We put a dressing on so you can shower with that dressing, and usually remove it a couple of days after, and then it sort of just heals in. So it's just a tiny little, like you got a little bug bite. And that's it. So it starts working. What's important, and also, again, very important to differentiate between the different types of pellets. So to answer, I don't know if someone asked that, but we use Avixius is the brand that we use. And the reason why I like it, number one, is bioidentical. Number two, they have a huge experience. They've been around the block. They're international. A lot of the big leaders in the field have worked with that product. And the other thing that I like about it is that it also, they have a patented mechanism of having a steroid with the material, which minimizes any potential reaction to the material. So again, not all pellets are the same. So you don't want to go to someone who's putting the classic old pellets that can potentially cause a lot of reaction. If they don't know how to do it, it can be close to the skin, so they can cause an infection and it can cause an extrusion. And most worrisome of all, if it doesn't have a slow release mechanism, you can have these big upshots in your hormone levels, which is exactly the opposite of what we're trying to do. We want to actually stabilize those levels so that your body is seeing a baseline level that keeps all the things we talked about, cardiovascular benefits, neuroprotective benefits, and the bone benefits and muscle benefits at the right level. And also, by the way, for men as well, now we know that if your testosterone, which means your testosterone levels are kept at regular levels, you actually have less risk of having issues with your prostate, as opposed to the up and down that you may see. So that's another thing for any men who are on this call, or any women who want to advise their loved ones to really understand. Don't go to the locker room and have the guy who told you, hey, just take this injection. Injections usually are not good because you're seeing a lot of up and down. Much better to have steady state levels with regards to the things that we're talking about. And very important to check your testosterone level to make sure that you're not overshooting with that, because that can cause a lot more problems. So Jean wants to know, do you prescribe bioidentical, or I think we talked about this already, bioidentical. And is it covered by insurance? Depends on your insurance. Even within the same, like if you're United, it's hard for me to say which insurance anymore, because within that, depending on which plan you are within United and which deal they have with your company versus others, and so it's become very complicated. So you have to check and see whether it's covered. But from our perspective, we treat you, we sort of, Ali sort of will guide you as to the steps that you need to take to get there. I'm over 60. Can HRT still help me? Yes, it can. But as I mentioned, you get the most benefit, at least from the studies, because the studies tended to divide the population over 60 and under 60. So you get the most benefit if you're under 60, because you're immediately coming out of that menopause stage, right? So it doesn't mean that you're not going to get the benefit. I would probably argue that by the time you get to 70, you're really not getting as much of the benefit, because remember I told you have these pros and cons that we have to constantly think about, but 60 is still appropriate. Angelica, can I do my own exosome treatment if I have autoimmune disease like Hashimoto? I heard that it's not recommended, but not sure if it's true. I need to know more. I need to know a lot more details about which aspect. Where are we talking about? Yes, Hashimoto is an autoimmune condition affecting your thyroid gland, but that's a conversation I should have with your endocrinologist. So we should both agree with regards to what is the best course of action. And if medicine and science is done correctly, people should agree, not disagree, right? Because science is really just one facet. It's not opinion. It's fact-based and it's science-based. So I think always try to engage your caretakers to have a conversation, because you're the one that is affected by it. And you don't want to sort of, people should not be taking sides. Everyone should agree, which is what is the right thing for you to do. Jackie, let's see, she wants to know, can you exercise after pellet insertion? We don't recommend that you immediately exercise, just because it can get sweaty, and that dressing, we don't want it to be there. So we recommend that you avoid exercise for about 48 hours. So that's our next one. PRP procedure, for example, I'm not sure what that means. I'm just seeing a very sort of I don't know what that means. Sorry, that's a very cryptic line. You may want to try asking the question again. But while I'm waiting for any other questions, as a reminder, you'll be receiving a text message. So please make sure you reply with a code word COSMO, COSMO, to be contacted for a consultation. And Ali will be in touch with you. And we go from there. All right. I think we have reached the conclusion of our discussion. I thank you so much for your time. And we're really excited. This is a really exciting field. And because we can do things now. You know, if this was 10 years ago, I wouldn't have a lot of answers for you. It used to be that the only answer we had was, you know, we can do some surgery for you. But now we can really manage you if it's a weight-related issue. GLP-1s are extremely effective. We have, you know, many patients that we manage with GLP-1s, the Ozempics and trizepatides. We have exosomes that are super exciting because they add a new dimension, not only for those of us that are older, but even for the younger patients, right? The young kids that are starting to see hair loss, we can really help prevent that loss by maintaining it much earlier, which can get into that game much earlier. And then hormone replacement, where, you know, especially for women and men, it used to be that we just had to deal with these symptoms of aging. And now that we understand why they're happening, we can actually bring you closer to where you were and sort of push that further back down. And with it, decrease the chances of all the problems that we see with aging, as we talked about, namely frailty, lack of balance, and lack of concentration, and so forth. So I think these are all super exciting fields. A lot is happening in our field, and we'll be happy to share it with you when you come and see us. All right, everybody, have a great night.